Thanks, Madam Speaker. Senator Gold, there's a growing momentum across Canada to remove interprovincial barriers to labour mobility, most recently through the One Canadian Economy legislation, which proposes mutual recognition of provincial and territorial certifications to enable workers to move between jurisdictions more easily. Yet today, physicians still face a different licensing requirement across provinces and territories, limiting their ability to go to work in response to areas of urgent need, especially in rural, remote, and underserved communities. Given that the federal government is advancing labour mobility and removing regulatory obstacles, when will the government commit to implementing a framework for pan-Canadian licensure for physicians?
Senator Gold.
Well, thank you for your question. Look, it's important that our healthcare system change to better serve Canadians. That means that all levels of government and healthcare partners must work together to do what is needed. We know, as you know and mentioned, that the licensing of physicians falls under provincial jurisdiction, that the Government of Canada remains committed to working with provinces and territories to reduce as many barriers as possible. Some provinces have already taken action amongst themselves to reduce these types of barriers. We heard yesterday from former Minister Lisa Raitt about how, and others, if I recall, that in some sense the federal government is taking its lead in some of these areas from the provinces, and I applaud the work that the provinces is doing in those areas of jurisdiction.
Senator Osler.
Thank you, Senator Gold. And this is an area, as Senator Seidman had spoke about, federal leadership would be extremely helpful. But as we work to improve labour mobility within Canada, we have to address the systemic barriers facing the internationally trained physicians and nurses who want to work in our healthcare system. And improving labour mobility should include efficient access for those with international credentials who are already in Canada. So what concrete steps will the government take to reduce these barriers and support internationally trained physicians and nurses to get their credentials recognized?
Senator Gold.
Well, the government is aware of this challenge. We all are as citizens. The government has invested, I believe it's in the order of $200 billion in discrete relationships and in direct health funding to provinces to help the provinces transform their healthcare system. And each of those arrangements have specifics tailored to the needs of the provinces and the priorities of the government. And we're hoping that this will help the provinces accelerate their process.